This is a video demonstration on the use of insulin pens. There are three companies that make insulin: Novo Nordisk, Eli Lilly, and Sanofi Aventis. The Sanofi Aventis insulin, Lantus, is their long-acting insulin. It's usually given in a 1 or 2 times a day, and this replaces basal insulin, that little bit of insulin that the pancreas is usually making every couple of minutes in between eating. The Apidra is the rapid-acting insulin. This is given around meal times or snack times or for corrections for a high blood sugar. The Lilly insulin that comes in a pen is the Humalog Quick Pen. Again, this is a rapid-acting insulin similar to Apidra and Novolog. It starts to work in about 5 minutes. It peaks in about an hour to an hour and a half. So that coincides with when your stomach is digesting the food and your blood sugar may be rising after you eat. In the Novo Nordisk category, we've got Levemir, which is the long-acting insulin, again given on a 1 or 2 times a day basis. This and the Lantus is basically a peakless insulin. The Novolog Flex Pen, we have 2 Novolog Flex Pens here. The Novolog Flex Pen, this is a disposable pen. This is a little more sturdy. This is the Novo Pen Junior. The advantage to the Novo Pen Junior is that it gives insulin in half-unit increments. And this is not a disposable product, but the insulin comes in these pen fill cartridges. You put them in like this, and then every click is a half unit. This is the only half unit pen that we will be using at camp. Now let me show you how there are also various pen needles that go with the use of the pen, and many of them are color coded. The purple ones are 5 millimeter length. There are new green ones. This is new for camp this year. These are 4 millimeters, so they're a little bit smaller. I do not have a demonstration of a blue that's an 8 millimeter. And this is kind of an in-between size. The white ones, these are 6 millimeter. So just to demonstrate whatever pen you're using, the process is the same. So I'm just going to use the Novolog Flex Pen for demonstration, and the purple pen needle, or the 5 millimeter. It kind of reminds me of an individual creamer that you might get at a fast food restaurant. You peel the foil off. This end is sterile. You put this on the end of your pen needle and you turn it righty-tighty, lefty-loosey. You take the protective cap off, take the purple cap off, and this is the 5 millimeter pen needle. We're going to first do an air shot. There's a potential air that can get in here, much like needing to pump soap or pump lotion a couple of times before you get any product out. So we're going to just go up to about 2 units. I have seen people use their little protective cap. We want to see that we have insulin coming out the end, and we do have insulin coming out the end. So we are going to dial up our dose. All of them go up in one. Every click is 1 increment, except for the Novo Pen Junior, which is a half a unit for every click. So in this demonstration, we're going to use 3 units: 1 click, 2 clicks, 3 clicks. And you also can see that the line is between 2 and 4, so that is at the 3 mark. When you go to deliver insulin, you pinch the skin, you put it in. I'm not going to put this in anything because I want you to see that there is a little bit of, you have to count to the count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's because there's a little bit of insulin that is dripping out at the very end, and we want to make sure that all the insulin gets to the patient. Then we're going to dispose of our pen needle using our sharps container. You don't have to touch anything. Again, we don't want people to get poke or stuck. You stick this right in here, counterclockwise unscrew it, and then you replace the cap. You never want to leave the pen needle attached because it becomes a way for germs to get in and can contaminate the insulin. And then you can dispose of this and your alcohol wipe for when you wipe the skin using a just in a regular trash can. It is beyond the point of this demonstration, but we have a very few campers on a combination of a NPH and regular regimen, and that insulin is drawn up. Usually in the morning, it's given a combination of some R and some N. They usually get R at dinner time and then N at bedtime, and that is drawn up by the syringe. So there are a lot of different ways for getting insulin. You always want to make sure that you have the right patient, the right medicine, the right dose, the right route, and the right time. At Camp Adam Fisher, every camper is given a little bag, and it will be filled with their insulin. In this case, they have a long-acting insulin of Lantus and a rapid-acting insulin of Novolog. And then you consult their chart for the doses. The little baggie will also have pen needles, alcohol wipes, and cotton balls just to press on the site so that it can absorb. So we look forward to having all of your help at camp, and if there's any question about the use of pens or insulin, please bring it to the attention of the medical staff. Thanks very much. At camp, we will, the insulin that is currently being used doesn't always need to be refrigerated. However, in a camp environment, we will bring these to the dining hall for administration right after meals and at bedtime, at bedtime snack, and insulin will stay back in the med shed in the refrigerator. Once the pens are opened, they are good for 28 days. So that is certainly within the time from camp, but most patients will use a new pen every month, just because insulin is a protein, and just like any other protein like milk, you wouldn't want to use it when it's out of date. Thanks very much.